Good morning and welcome to ICUS Bubble TV. I'm Robin Adams and I'm joined today by one of the leading experts in the field of contrast enhanced ultrasound and contrast microbubbles, Dr. Brian Foulkes. Brian, thank you for joining us today. Perhaps we could start this by asking you to say a little bit about yourself and where you're working and the practice that you're in.
Sure. I'm at the University of Michigan. I'm professor of radiology and biomedical engineering, so my emphasis has been on the basic science associated with how bubbles work. That started even as far back as when I was a graduate student. And so I've been looking at what's called acoustic cavitation, or the interaction of gas bubbles with ultrasound fields, for over 30 years now. So it's been a passion and a calling over time, and ultrasound contrast agents then are a natural part of understanding those bubble dynamics. I'm a physicist by training, and so I want to understand the underlying physics associated with how these bubbles interact and how ultrasound imaging systems can use those to better image inside the body.
Very interesting indeed, and a true expert in the field. So perhaps we could just go on from that and ask you to talk a little bit about how microbubbles work in a way that our viewers will be able to understand.
Sure. So ultrasound fields, the imaging systems that we use, they oscillate the pressure. So they change the pressure locally with a short pulse that's then able to make an image. So the bubbles then respond to that pressure pulse. So you can imagine that if you have a bubble and you increase the pressure, then it squeezes the bubble down. And then when you decrease the pressure, the bubble expands. And so this oscillation of the bubble actually produces a sound of its own, and you're able to image the sound then that's coming from these microbubbles. And they make unique oscillations. So the oscillations are not always an oscillation that's just following the pressure, but they can actually oscillate twice as fast or half as fast as the ultrasound field, depending on how you drive them. And so these produce very unique ultrasound signals that allow us then to see just the bubbles inside the body, and we can actually track then the trajectory of these bubbles going through blood vessels and in other locations within the body. So that's how ultrasound contrast agents work with ultrasound imaging.
And so how do microbubbles compare with alternative imaging options?
So there are certainly unique properties associated with these ultrasound contrast agents. For example, this response to pressure is something that you don't get from an MR contrast agent or a CT contrast agent. So there are these unique signatures that can be pressure dependent. They can also be dependent on the local ambient pressure. Some work at Thomas Jefferson University has developed what's called subharmonic imaging amplitude modulated pressure estimation. And this shape mode then allows you to be able to see what's happening for the local ambient pressure inside the body. We're looking at it and using that methodology to actually look at pressure inside the urinary bladder in pediatrics, for example. Because pediatrics, you want to be able to make a relatively non-invasive measurement of pressure in the bladder, in the urinary tract. These are very, very important measurements. And right now you have to do that with X-ray contrast, and you can't do the pressure measurement that's a natural part of understanding what the flow and the pressure is inside that urinary tract.
So when would you actually use microbubbles as opposed to other forms of contrast imaging?
So certainly for the safety profile for ultrasound contrast is really, really good. So under conditions where patients might have complications associated with using an MR or a CT contrast, ultrasound contrast provides an excellent alternative to those types of conditions or measurements and applications. Ultrasound contrast agent, because they're microbubbles and they're constrained to be inside of the vessels, they actually provide unique flow information that you can't get from an MR or a CT agent, because those agents actually diffuse out of the blood vessels. So there are unique properties associated with ultrasound contrast agents, because they are these microbubbles that provide a trajectory or a tracing of flow that's only the flow and not the diffusion of the agent out into the tissue. So that makes them a bit unique.
Absolutely. And talking about flow, as a matter of interest, how does this affect workflow in a hospital environment?
That's an interesting question, and actually ICUS has done some excellent work on trying to understand that workflow, provide tools associated with being able to integrate contrast agent into the clinical setting. It's not something that has been traditionally done in ultrasound, and so having those tools, having an understanding of what personnel you need and how to train those personnel is very, very important to being able to do that. But many people now have this experience. Many people now understand how to be able to do that integration. And so, although I'm not a clinician, but I understand from clinician colleagues that the integration into the workflow for the use of contrast agents is becoming more and more common and better understood.
And following on from that, let me ask you, where do you see the CS field in general going over the next 12 months, perhaps 5 years?
Oh, I love the dichotomy between 12 months and 5 years. That gives you a wide range to operate on. So certainly we would like to see more and more use of ultrasound contrast agents, especially in applications, non-cardiac applications, for example. That's a very, very growing field. I'm in radiology. I'd like to be able to see ultrasound contrast agents used in a lot more clinics around the country, particularly for kidney and liver evaluations for lesions. Looking further down the line, ultrasound contrast agents for being able to monitor microvascular flow is an important area, and an area that would apply to many, many potential clinical endpoints. The unique thing about ultrasound contrast agents is they're a very natural theranostic tool, meaning that they can do not only diagnosis, but they can also do therapy. So these bubbles, when they interact with the ultrasound field, can do a lot of different mechanical actions because they're oscillating. And so there's evidence now and even clinical trials going on using ultrasound contrast agents to actually open up what's called the blood-brain barrier. So drugs that are given to patients, for instance, for brain tumors, can't get the drugs to the tumor because there's a natural barrier that exists, and the bubbles will actually open up that barrier temporarily and allow the drug to go into the location where it needs to go. And so examples like that show a potential for bubbles and uniqueness of the ultrasound contrast for being able to do not only diagnosis, but therapy.
Very interesting indeed. And finally, give us some thoughts about what we actually need to do to be able to help this field grow.
That's an interesting point. Certainly there needs to be investment in the research fields that people are working in for these longer term developments. We need the agents to achieve a level of common use and approval by the FDA to be able to use them clinically in a lot of different applications. and so that physicians will feel free to be able to use them and in their clinical practice. So there are several things like that, those types of infrastructure investments for being able to get agents approved through the FDA, and research investments to be able to pursue these unique attributes of contrast agents, bubble contrast agents, for diagnostic and therapeutic applications. This is actually just the beginning of our endeavor of being able to understand how to use these agents. And so we have some applications that are already in process, but the range of applications that are possible are unlimited at this point.
Dr. Brandfax, very inspiring. Thank you very much for joining us today.
It was a pleasure to be here, Robin. Thanks.